Hi, everyone, and welcome to another edition of Wound Care Pro with Nurse Practitioner Anne Walsh. Every single week, we come to you live and we talk about wound care and everything related as much as we can to wounds from head to toe. Today, we are focusing on the toes, the feet, specifically important for people with diabetes, peripheral artery disease, circulation issues, right? You get wounds that won't heal and you get pressure sores, all that kind of stuff on your feet. So we want to talk about a very important topic related to that. It's not a very popular one. Offloaders, offloading shoes. And Anne knows why. So many patients do not like talking about this topic because most offloading shoes are not very attractive and not very stylish. And they really do stand out for the most part. But you know what? They're very important, and we're going to talk about why. Anne, thank you so much for being here. For those who don't know, she is the founder of Woundcare Pro, the app. Make sure you do download it. It's only $4.99. It's meant for physicians and clinicians, but I will tell you, we've had a few patients in our network that have downloaded it and found it very, very helpful in caring for their wounds and helping them to ask the critical questions of their own wound care specialists. So really important. But again, Anne, thank you so much for doing this every week.
Sure, you're welcome. Great to be here.
Offloading shoes. What exactly are offloading shoes and how do they differ from footwear, regular footwear?
Yeah, well, somebody with diabetes or neuropathy in general and poor circulation, they may have changes in their foot structure just from not feeling and where they're bearing weight. And over time, that could lead to calluses and that could lead to an ulceration and all the risks that come along with that, infection and, God forbid, amputation. So it's very important if those structures of your foot are changing that the shoe accommodates that. Otherwise, you have a shoe that is rubbing, maybe too tight, and you don't even realize it. And you start seeing redness on your foot, you may get blistering and again, calluses. So that's telling us there's unusual pressure going on that part of the foot. So it needs to be offloaded. In other words, a shoe adapted to get the pressure off those areas.
Now, is this something where you're only getting one offloader, or are we talking both feet can look the same?
I mean,
Sounds like
typically it may be one foot if we'll say you have a diabetic foot ulcer on one foot, but not to forget the other foot. Because if you get some kind of accommodated shoe on the foot with the ulcer, it may throw your balance off a little bit. So you may need an insert on the other foot to sort of balance it out.
Oh, so it sounds like these offload, they can actually be just insoles for your regular shoe. And you talked about it before, making sure there's a wide toe box, especially if you're diabetic and especially if you do have a wound.
Correct. Yes. If you have minor issues with your feet, that may be suffice for you to have some kind of offloading insert, just so you're not putting pressure on an area that's prone to blistering or what have you. If you do have a diabetic foot ulcer, you may need something more fancier, like what they call total contact cast, where literally a cast is made to the shape of your foot to offload that ulcer so that it can heal. Because every time you're walking on that area, you're setting the stage for more complications and the wound not healing. And the longer it's opened, the more these complications can happen.
But it's good news for some that they don't have to get some big ugly boot.
Right, right.
They can actually get an insole for regular stylish shoes. Well, maybe not so say. I mean, wide toe box. How stylish can they be,
Absolutely.
right?
I mean, if you go to your podiatrist, oftentimes they could even do it in the office. They could fit your foot for a special mold if you have a high arch or a flat foot, or just your foot shape has changed a little bit. That may suffice to get the pressure off those areas. If you
So
have a diabetic foot ulcer, that's different, but
aside from the price, how do custom made, since you were talking about custom made, how do custom made offloading shoes compared to the off the shelf ones?
yeah, I mean, sometimes you can go to someplace like CVS and then you can stand on, they have a machine, it'll see where you're putting the pressure points. So something like that, you may be able to fit into your wide box shoe, your wide toe box, your toes aren't cramped, but at least they'll get the pressure off. Sometimes you may know if you're walking, you're on your feet all day, you feel, they're really sore in certain areas. And sometimes that's all it takes to get the pressure off if there's minimal changes to your foot. But certainly
Yes.
your podiatrist or your healthcare clinician could evaluate your feet and see if something like that is indicated.
You know, so many times we sit and we wait until you do get a wound that won't heal. And I know this is probably a little bit rhetorical, but you know, talk about the connection between proper footwear and wound prevention in these patient populations with diabetes and peripheral artery disease, especially since walking is the best medicine to improve circulation. So proper footwear is incredibly important.
Absolutely. And we're on our feet all day. We hope to be mobile and we don't want something setting us back from that. But yeah, just talking about diabetic foot care itself, prevention is key. You want to examine your feet daily, you're washing your feet. And if you see there's reddened areas, then you have to look and say, wait a minute, what's the footwear I'm wearing? Is this too tight for me? Am I putting undue stress on a certain part of my foot? And so that's an important part of the daily diabetic foot care. Examine your feet for any redness, any blisters, any callus formation, and then that may be due to the footwear you're wearing. Often patients are in a tight shoe, which might look pretty, but it's not enough space for the toes. And where somebody else may say, oh, my feet are killing me, let me take them off to give my feet a break. The diabetic person with neuropathy may not know that. And by the time they're looking at their feet, they may have a blister and an ulceration forming.
Now, this may be obvious, but you know, what specifically is it about offloading shoes that help in the healing process of existing foot ulcers?
Yeah, it's like when somebody has a pressure injury, like a bed sore, somebody may note as if they don't get off the area, they can never heal. And with the foot, diabetic foot ulcer, it's the same thing. If you're not getting the pressure off that wound, every time you're walking, you're pounding the area, you're putting pressure on it, you're causing friction, injury, any new tissue it's trying to heal, it's opened up again. So it's sort
Mhm.
of that's what it is, just getting the pressure off. You're trying to treat what caused the thing to begin with. So if you have a shoe and you're putting all this pressure and the shoe is tight, if we remain with that shoe, no matter what fancy dressing we put on there, it can never get better because one of
Yeah,
the underlying causes is not being addressed. And that's a big part of it.
big.
Big,
So,
big.
what are the key features to look for in a good offloading shoe?
Yeah, so just that there's enough space that it's not too loose where you're gonna have friction if your foot's moving around, and of course not too tight. You have the toe box we speak of that your toes aren't being squeezed in as somebody who wears high heels may like something like tight like that. It could cause problems. And then over time, you may develop a bunion or other kinds of foot deformities, hammer toes. Now you need to accommodate those. So if you're wearing a typical shoe before you have the bunion, that's going to be putting pressure on those areas of your feet. Because a lot of times that's what led to the bunion or the hammer toes, ill-fitting footwear, along with neuropathy and the way we're putting pressure on our feet.
So, different types of conditions, different types of offloading shoes, whether full shoes, whether insoles, right?
Absolutely.
And
Absolutely.
the key is to talk to your podiatrist to determine which might be best for you and your condition and your situation, and specifically your symptoms.
Absolutely. And if you do have a wound on the bottom of your foot that it's not responding to any treatments, it could be that you're not offloading it enough. And there are these different kinds of options. Like I said, total contact cast. And they have a new one called the easy total contact cast. It's easier to apply and that gets the pressure off and it's changed weekly. Sounds drastic, but it's the gold standard and that'll get that wound healed, 60 or 80% faster than without. So if you're frustrated with this wound, you may want to consider something like this.
What are some common mistakes that patients make when choosing or using their offloading shoes?
I think sometimes they may not use it as often as they should. They may be walking barefoot in the home, and you really want to avoid walking barefoot because, again, with the neuropathy, you may step on something. The temperature might be too hot in it, if you're on sand, let's say, or something like that. So you just want to use the shoes every time you can. And then if they start getting worn, you may need to get them reevaluated and get a new insert over time.
Yeah, how often do you usually get them? Do they typically last? Do you get them
I mean,
replaced? Like a running show is like every 6 months.
6 months, yeah, a year, something along those lines, definitely, depending on how much you're walking around and using them.
And that's you alluded to the fact that most don't wear them enough.
Right.
And you should wear them as much as you can. So How often is too often? How little is too little? Just what is the timeline in which PAD and diabetic patients should be wearing their offloading shoes? Is it safe to be wearing these offloading shoes all day long?
Oh, definitely. I mean, wear them when you're walking because that's what they're there for, to get the pressure off those pressure points. So you definitely want to use them. Sometimes, if somebody did have offloading boot, if they're feeling that they're not they're unstable on it, or they're, balance issues, then it may not be for them, because you have to look at the safety part of it too. So while some of these shoes may be better than others, if it's going to cause you to fall and it's going to defeat the purpose, then that's a different story. But if you're fitted for a good offloading shoe, every time you're walking, basically you should be wearing it.
And I should have probably asked this early on and maybe even one of the first or second questions, but you're talking about offloading insoles and you're talking about offloading shoes. Two very different things. They serve very specific purposes. Do they ever work in conjunction with one another? Do you ever wear them together?
I guess it would be a case by case basis. I mean, I know I have an insert for my shoes, so I'll move it from shoe to shoe. So if I'm wearing a sneaker, I'm going to put it in that sneaker. If I'm wearing a walking, shoe on to walk on the boardwalk, I'll transfer it from that into that shoe because they're not cheap, but if you get them custom made, but it makes such a difference as far as getting the pressure off and reducing the burning that you may have or other symptoms a person may have. But if the actual shoe is made for you, you'd have to ask the podiatrist, can you put an insert in this? Because certain times they won't fit, and then the top part of the shoe might get a little tight. So I think it depends. You have to remove the insole of a regular shoe to put it in there, you know, certain custom ones. So you have to ask if an actual shoe is made for your foot. Can you put an insole in that?
I would imagine that with offloaders, that they would be probably more comfortable. I mean, just thinking inherently what an offloader, right? You're offloading the
Exactly.
pressure, that they would be more comfortable. What advice though would you have for patients who find offloading shoes very uncomfortable or difficult to adjust to?
Yeah, I mean, I would talk to whoever, if you got them through the podiatrist, maybe discuss and see if there's something else that's, step down that you could get away with if you're not walking as much. And, there are more stylish ones if somebody's worried about that. Because I know I've seen patients squeezing their feet into a tight shoe because like want the appearance of the shoe versus not realizing how much damage you may be doing. I mean, I
Yeah,
wish I knew years ago, like, I think I would have not had the burning I've had in my feet now had I wore the right. I didn't know. I just
yeah.
dealt with it, and
So how can patients determine if they're, and this one seems like Captain Obvious, but I think it's important that we ask the question anyway, because it might be different for different people, and I would assume it is that, um, how can patients determine if their offloaders are working effectively for their situation?
so I think, when you're doing your daily foot care and assessment, if you're seeing any red areas, if you're seeing any blistering, if you're seeing any callus or corn formation, then that's saying you're still getting a lot of pressure in that spot. So if you had an insert, it may need to be adjusted. If you have the offloading shoe, maybe something wasn't, you know, it could be taken back and adjusted a little further, or some padding put in there to accommodate that.
And so how is, I'm curious, just we had a guest from a company that had a very an AI driven
Oh,
um boot, which I thought was very interesting. Can't remember the name of it. We had a patient check it out. It was a little too high tech though
okay.
for this particular patient. I'm curious just from your perspective what you've seen. This is obviously new, not on the market yet. When it is, it's probably going to be thousands of dollars, of
Oh,
course,
yeah.
which doesn't fit our typical patient population. But how have you seen technology in offloading shoes advance in recent years? And what advancements do you foresee in the future, or do you think um, there are still so many gaps that you don't even foresee being filled in this space in the near future?
I mean, definitely a lot of gaps and a lot of training needed. I mean, there's a shortage of wound specialized clinicians. So to even get the gold standard, which is the total contact cast, and then one came out, like I said, the easy total contact cast to make it easier for clinicians to learn. but where do you find them? And, who's trained in it? You need a podiatrist that's trained in it, or a physician, or, wound center. So it's hard to even get the gold standard. So we definitely need technology to help make it more accessible to all of us, even if it's not top of the line, at least it's going to be better than what we have now. Because it's a really big part of wound healing. We'll see patients going on for years having a wound just never healed because it was never offloaded. And they may be on courses of antibiotics. They may, have complications, and the wound may be closed and then it reopens again. Many of them, you're like, yay, it healed, but it reopens because the offloading piece has still not been fully addressed.
What limitations have you experienced in being able to prescribe offloaders for patients? We had one patient that was in North Carolina, and because he wasn't classified as a diabetic, even though he had a wound on his foot that would not heal due to peripheral artery disease, his his Medicaid, the federal insurance for low income, would not cover an offloader for him. And he was a full-time construction worker.
Wow. Yeah, that's unbelievable. I mean, there's a lot of, impediments to us getting what we need. There was even where nurse practitioners couldn't sign the prescription for diabetic shoes. I believe now in a lot of areas they can. So yeah, unfortunately, we got to keep lobbying to get these things covered because they want to pay for the person to go to the hospital and, deal with the antibiotics. They're not thinking prevention is key and to prevent all these complications.
Well, and even I mean, management. If
Ex-
someone has a wound
Right.
and they don't have an offloader, that thing is not healing. And we're going to see a revolving door of amputations down the road for this patient.
Absolutely. And that person's a construction worker, so they can't work. And then it just spirals out of control with the cost of all those and not to mention the quality of life of the patient if these things aren't covered.
So what suggestion would you have for patients if the insurance won't cover the offloader? In that situation, I mean, I sported, it was $350 for one
Wow.
shoe.
Wow.
It was expensive. Um, and I mean, even especially for us as well. And so any other suggestions that you might have? Amazon, I know you mentioned at least for the insoles, you could go to the local, let's say CVS that might have a Dr. Scholl's insole machine. But, for those that do have these wounds, you need something probably a little bit more professional than that, I would imagine.
Absolutely. I mean, I think tapping into your physician or your nurse practitioner or whoever your provider is and the social work, because sometimes I know when I prescribe certain medications, so first line therapy, what have you, and then the insurance won't cover what the patient wants. And then you have to write or make phone calls to say
Yeah.
why they tried these things, hasn't worked for them. They're, the side effects are unbearable. So they need this particular medication. So it's sort of like that. It takes a few phone calls sometimes and a letter of medical necessity. And then oftentimes, if you explain it, because people sitting making these decisions sometimes aren't medical people. They could just be the person, whatever charged to do that task. So they don't really know to tease it out. But if you think, put it as a medical necessity and all the complications that can come of them not getting it, sometimes you may get somewhere.
Yeah. Well, thank you, Nurse
Oh,
Practitioner Anne.
sure,
Is there
sure.
anything about offloaders that I may have missed? You've definitely refuted it. I started out this segment thinking about the stereotype of offloaders.
Right.
I was thinking about these big, ugly boots with Velcro. And you've made a believer in me that there are different forms, and such as insoles, which I didn't really think about offloading insoles as being a critical, part of this entire process for patients. So insoles are definitely an option in the right shoes, likely in a wider toe box shoe, for a lot of
Correct.
these patients, which is really good, even with a wound.
Yeah, absolutely. Absolutely. I mean, they could be modified to get the pressure off, like that first metatarsal head, what have you, because when you're walking, that's where you're putting all the pressure, and that's where these wounds sometimes appear, or a lot of times appear. So just to get the pressure off, better than having nothing, if you don't want to go for the gusto. I mean, I could show a picture of some of the boots if that was
Yeah, that would be
anything.
great.
Let me just disconnect this because I'm on a different computer, so I could share and they're clunky, but sometimes if somebody's been dealing with this for so long, and if they have access, they might not mind short term.
Yeah,
Let's
that would
see
be
if I
great. We
could
always like visuals on this show.
yeah, let's see
And
if I could.
this time we don't have to do any disclaimer for any
Now just well,
graphic
there's two
images.
wounds. they're two wounds, but they're not so bad. I'm just looking for the share thing
My
here.
YouTube producer would enjoy that. We had an interview yesterday with a leading technologist. She is our diagnostics pioneer of the year, Jill Somerset, and she created a technology called pedal acceleration time (PAT)
Oh wow.
that ends up measuring the flow velocity going from the ankle into all the way to the wound. And so she can tell people in real time whether or not the foot's perfusing based on what they're doing, and the likelihood that that wound will actually heal. So she had all of these graphic images on there, and it was great. We did the disclaimer and everything else going into it, and Facebook censored me.
Oh wow.
So
I
it
don't know why
has
I don't see.
now graphic images right across the front of it, and they sent me a warning to let me
Oh
know
wow.
that they put a little censorship. And my YouTube producer, Josh, says, of course they did. Yes, of course they did send that warning. So um, it's on there. Up, we do have graphic images. So I will
Well,
use
just
our
two
disclaimer.
wounds. They're not too bad, I guess. Well, it
Um,
depends on.
Make sure, close your eyes, turn the other way. There are a few graphic images of people with non-healing wounds on their foot. Um, so if you can withstand that, definitely look, because it's worth looking at some of the images of these offloading boots. So you see, those are some of the boots that I was talking about that
Yeah. If
we
you're
even
gonna,
had
yeah.
one patient that was saying that he had to be comfortable in wearing it. He had to make up a story about some bar fight he was in or something, or
Oh,
some, like, he was
yeah.
a race car driver, and there was some heroic accident or whatever where he won the race, but he flipped or something. I don't know. It was something crazy, but making up a story that was more than I just have a wound on my foot, which seems, some patients just feel ashamed.
Yeah, yeah, definitely. And I just put in the very bottom left there, I just put that person doesn't have any wounds, but this is a way of offloading the heels so you don't get a pressure injury. So offloading is to do with pressure injuries as well as diabetic foot ulcers. And it's like when somebody has a venous leg ulcer, they have to wear wraps like this for compression. They don't want to do it either. So it's tough because those are the gold standard to get healed, so it's kind of depends on the situation the person's in. If they've been dealing with this a long time, maybe worthy having this for a couple of weeks and then hopefully heal and then downgrade to something else.
Wow, that's amazing. Well, thank you so much, Nurse Practitioner Anne Walsh. Again, if you have any questions about wounds, wound healing, I assume you have some information on offloaders there, and particularly presented in a way that is instructional for clinicians and physicians. But as I said, we've had several patients go in there and get a lot of really great information, because we do have so few certified wound care professionals to go around. And so a lot of times, if you as the patient can do some of the research on your own and be able to go in well informed with some poignant questions to ask your doctor and your clinician based on that information you find on Woundcare Pro, I think it's definitely helpful. And it could improve the care that you may receive. And so if you want to, go ahead and download Woundcare Pro, and you can get it on the from iOS. You can get it from the App Store, from Google Play, wherever you buy your apps. Okay. Thank you so much, Nurse Practitioner Anne Walsh.
Marcia put a comment in there that her son had him for overpronation of his feet.
Oh, wow. Yeah.
Yeah, yeah,
So it's used for a lot of different things.
yes.
And any idea of what you want to talk about next week?
I haven't even thought about it. I was so into the offloading.
Me
That maybe
too.
I'm trying to think. I mean, there's all these other kinds of ulcers one can get on their legs. So maybe arterial ulcers or venous leg ulcers, perhaps.
Oh,
Could
venous leg ulcers. I think that would be really
be a
interesting.
good
We can
one.
talk about that. We can talk about maybe some of the different care, what causes them. I think that would be amazing, because chronic venous insufficiency is a really big problem. It's a
Yes.
very prevalent problem, and it's not addressed soon enough in so many patients. And a lot of it is because there really wasn't an early treatment except for compression socks and those compression wraps that you were talking about just a few moments ago. And if you don't have those, don't get diagnosed soon enough, you may end up with what are called venous ulcers. And so we'll get into that next week. That's a great idea. Thank you again, Nurse Practitioner Anne Walsh. We really appreciate you.
Thank you. Thanks, everybody. Bye now.